You must see your doctor if your baby has a fever, is lethargic, appears irritable, refuses to eat, or is vomiting.
Teething is common and may start at any time after 2 months of age. What do we mean by teething? There are various symptoms associated with teething, but the conventional ones are usually those where a baby has a lot of drooling, puts his or her fist in her mouth frequently, has a low-grade temperature, less than 38, but 37.5, something like that. The stools may be a bit looser, and there's usually more fussy periods or irritability. They may also touch their ears as if they're complaining or having ear pain. Vomiting can be a sign of many things. It can be a sign of an obstruction, a gastrointestinal obstruction, such as a tight muscle where the stomach empties, and that can cause vomiting. Vomiting can be a sign of infection. It can be a sign of a metabolic problem. So there are multiple causes of vomiting, all of which can be important and need to be ruled out. Diarrhea in the newborn period certainly is a cause of concern, particularly if it's associated with blood or with fever. If the stools are particularly frequent and if there's a lot of water loss with the stools, which can be gauged by parents according to what it looks like on the diaper, then it can lead to fairly rapid dehydration in a young baby. Decongestants or other over-the-counter medication are not recommended. Their side effects are important and can sometimes be quite significant in babies, and there are no really good studies that have ever been performed in infants that have shown that they are in fact effective for what they are purported to do. The most common reactions to the vaccines are usually fever, irritability, fussiness, some redness and swelling at the site of injection, and rarely vomiting. That's an unusual complication. Fever is usually under 38.5, 39. If it's above that, it's a little higher than normal, and we'll often ask them to contact us if that's the case. But usually those are the main complications.
It is important to move after you give birth. You know, in the past they would keep patients in bed for a long period of time, and in fact now for a vaginal delivery, once the epidural is worn off, if you have an epidural, once your legs the motor function comes back, women should be up and walking and ambulating as soon as possible, and for a cesarean section, usually by the following day or within 24 hours, women also need to be up and walking, and that improves their recovery, specifically for the circulation in their legs, because the postpartum time is a much higher risk period to develop a blood clot in the legs or rarely in the lungs, and those could be potentially very serious. For a routine, uncomplicated vaginal delivery, really fairly quickly they can start to resume activities and exercise. I would say even within 2 weeks or 3 weeks, if they feel well enough. And of course all of that has to be individualized, depending on how the woman feels. And I always tell my patients, you have to read your own body and know when you feel ready and when too much is too much. And for a cesarean birth, we usually would say 4 to 6 weeks, although that may be even a little bit long. Also for an uneventful, uncomplicated cesarean, maybe even by 3 to 4 weeks. If some light exercise, a woman may be able to resume again if they feel well enough and they're not having any problems or symptoms that are bothering them. Less than a quarter of patients will be at their pre-pregnancy weight by their 6-week checkup. Most patients, though, should be at their pre-pregnancy weight by about 6 months postpartum. You know, and some women do find that they always will have an extra 3 or 4 pounds that are difficult to lose, but that's common. For the perineum care is, of course, every time you go to the bathroom to urinate or to have a bowel movement, we usually have a spray bottle, a spritz bottle with warm water, and you just spray yourself. That's all that's really needed is warm water. And of course, wiping yourself should always be from front, to back.